All right, I think we can begin. It's just 1 minute past 2 o'clock. I'd like to welcome everybody to the second in our webinar series on social policy in post-COVID Africa. We toyed with also calling it social policy for a post-COVID Africa because in addition to looking historically and comparatively at social policy, we also want to move the discussion over this webinar series to thinking about what the future of social policy should be. So both analytical and also a normative sort of conversation about what kind of social policy we have been doing and what kind of social policy we will need moving forward. We had an exciting beginning to the series with Professor Jimmy Adesina's just a very masterly historical overview of social policy on the continent from colonial to COVID times. And I see that he is here today to see where Dr. Kpessa-Whyte is going to take the conversation that he started for us last week. I'd like to introduce our speaker for today, who is dealing with the topic social policy in times of crises. You would all have seen the little synopsis, so I won't go over the topic, and he's going to spend time doing that anyway. So let me just tell you a bit about him. For those of us in Ghana, because of national events, we might have heard his name in other contexts, but those of us in Legon know Dr. Michael Kpessa-Whyte as a senior research fellow in the Institute of African Studies, specifically with the History and Politics section. He has a PhD in political science from McMaster University in Canada, and considers himself a political scientist in the tradition of comparative public policy and political institutions. In between doing work here, I think he tried to apply his public policy perspective by being a policy advisor in the Office of the President of Ghana with dual responsibility as Executive Director of the Ghana National Service Scheme. So that was between 2013 and 2017. But with all of that, he is still the author of several peer-reviewed journal articles and book chapters. And he also teaches various undergraduate and graduate courses. We are very pleased at CSPS to have him be an external faculty involved in both teaching and supervision in our Masters of Research and Public Policy program. Dr. Kpessa-Whyte's research interests include social policy and socioeconomic transformation in Africa, aging and retirement income security policies for the continent, and the politics of the early post-colonial Africa, and also public policy and democratization in Africa. So this is just a very brief profile of his interest and his accomplishments. And I'd like you all to join me in welcoming Dr. Kpessa-Whyte to give us the second in our webinar series.
Thank you very much, Professor Nana Anido. And I am very, very grateful for the opportunity to lead a discussion or a conversation around social policy. Let me also thank all those of you who have found time in your busy schedule to join us. This is certainly an ongoing conversation. And I am particularly happy because for a very long period of time, social policy has been treated like the house help who only cleans the house after the guests are gone. Social policy has been very useful in contributing in many ways to the progress of many societies, particularly the advanced industrialized societies, and even our own societies as well. But more often than not, the credit doesn't go to social policy directly. We found a way of expressing it in different ways, either under the broader nebulous terminology of development or some other disciplinary areas that may have clouded its obvious contributions to human well-being. Let's get it that social policy is not entirely new. It has been with human beings for as long as human beings existed. It is about human welfare. It is about human well-being. It's about how the individual and the collective of people are protected, capacity enhanced, so as to ensure that they enjoy good life, but also contribute to the progress of the very society of which they are a constitutive part. Last week, we had a very fruitful discussion with the very venerable Professor Adesina, who's many works in social policy I have been a student of in terms of reading and learning from. And of course, who has also been one of the pioneers in terms of working on social policy in Africa, together with quite a number of very strong and heavyweights in the area. And so I wouldn't go to some of the things that he had already touched on, because it will be like trying to repeat what has been said by the master himself, to put it in a different way. However, I will start from I mean, as a way of getting as a background, from one of the definitions that he used, which is drawn from the works of Nkandewere. And here, social policy is considered as collective interventions that directly, collective interventions to directly affect social welfare, social institutions, social relations, and concern with distributive effects of economic policy, the protection of people from the vagaries of the market and changing circumstances of age, enhancement of productive capacity of members of society, and the reconciliation of the burden of reproduction. So here, this is a field that right away appears to be very concerned with the well-being of those who constitute what we call human society. And the aim essentially is to ensure a certain minimum national protection for all citizens, particularly against disruptions as and when they come, in terms of, I mean, income disruptions as and when they come, perhaps due to age, poverty, disability, ill health, unemployment, and destitution. And of course, we also heard from last week's presentation that as a field, it tends to move on a certain number of policy instruments, or it finds expression in a number of policy instruments, particularly in education, healthcare, housing, employment, fiscal policy of governments, agrarian reform, social security and care, and so on and so forth. Each of these, in a sense, is a discipline. It's a discipline, but they all come together to make social policy what it is as a field that is highly multidisciplinary in what we know about it. We presently live in a world where COVID-19 has basically gotten everybody to start thinking about what is next. We appear to be in a crisis. And it is so because if you look at what has happened since late 2019, when COVID-19 outbreak was first announced and had gotten into several countries, its adverse effects and policy responses of governments appear to have had some ramifications for a number of vehicles through which the human well-being or social policies find expression. We have seen educational institutions being impacted heavily in terms of closure of schools or suspensions of schools from basic to tertiary levels. And in some cases, we have seen the closure of schools or as a result of lockdown, resulting in individuals working in those educational institutions immediately facing unemployment and other acute labor market situations. It is a health crisis, but it's a health crisis with many ramifications also, or adverse ramifications as well. It has implications for everybody, including frontline workers, including pressure on health institutions, personnel, and so on and so forth. And because of the very peculiar nature of the crisis and the response from governments in terms of restriction of movements and lockdown effects, it raises questions about housing, especially for the large majority of people who make their living in the informal economy, where place of abode or house is really not necessarily a house. And for the large, number of people who also basically have really not gotten any place they could call a home or a house at all. And we also know that by the nature of the pandemic and the responses, there have been some concerns about labor market issues. Lockdown meant that people could not go to work. We have seen situations where people have to run shifts. We have seen some people losing their jobs. We have seen some people having to find different ways of working. And then, of course, also there are questions raised in relation to social security, food security, and prices, of course, associated with countries that depend on food imports, and of course also for care. But in all this, we need to keep in mind that the well-being of human beings in society do not occur in their own accord. They actually require a very purposive and deliberate effort by individual families, organizations, communities, and actually governments. And this is where linking the understanding of social policy to the earlier definition that it is the collective intervention actually becomes very, very important. If you look at the literature on social policy in terms of the evolution of social policy and the use or importance or relevance of social policy in the world across time and space, it does appear that social policy have always had some very close, very symbiotic relationship with crisis or challenges or problems in one form or the other. There have been times when social policies have been seen as the key instrument for resolving socioeconomic crisis. And then there have also been times when social policy is either victimized, blamed, or held responsible for what is seen as socioeconomic crisis. And then, of course, we could also argue that there have been times, particularly if you take the context of Africa and post-colonial, early post-colonial Africa, there have been times when social policy was deployed very proactively to prevent potential crisis in different forms. And we would go through these three elements and then show how important social policy has been in dealing with, in relating to these observations. The first relates to social policies as a response to crisis, and it has to do with much of what we know about the advanced industrialized world, those that have come to be called welfare states. And the scholarly literature on what is today's welfare state seems to suggest that industrialization, which is what many of the countries in Africa also appear to be pursuing or are imagining themselves to be pursuing, came with economic growth, which is what actually many people want, because with growth, the economy expands, it opens up new opportunities and so on and so forth. But in those early days, growth and industrialization also came with a number of challenges for which the societies were not adequately prepared. So for instance, modernization and industrialization led to the breakdown of traditional forms of social protection and the life of a family. There was also growth in population, and then more importantly, the growth in urban population and urbanization. Then the creation of landless working class, then political mobilization, the rise of cyclical unemployment, changing patterns of family and community. And then, of course, the industry's own need for a workforce that may have to move from one part of, let's say, a country to another part. But not just that, the fact that the workforce, individuals who constitute part of the workforce were also required or were better preferred if they were very healthy and literate as well. So taken together, countries began to react or to respond to the challenges that the industrial process was throwing out, into the society. And the response that were generated came in different forms. Many countries, approach it differently, and that explains to some extent the variations in what we call the social programs in many of the advanced industrialized countries. But one thing that was sure was that in almost all the variations, every single one of them took social policy as the key thing because of the fact that it was seen as the one most important driving force behind building the most productive workforce that could continue the industrial process and also provide the kind of better life and good living that people actually require. If we take, for instance, the example of Germany, which was one of the earliest countries that has introduced quite elaborate social program, the model that became the Bismarckian model, the chancellor at the time, in expressing his views on why the programs, the social programs were being introduced to provide some well-being for the citizens, particularly workers, had this, this quote on the screen, which I'm sure you can see. So the real grievances of workers is the insecurity of existence. He's not sure, that the worker is not sure that he will always have work. So, and he's not sure that if he will always be healthy, he's not sure if he will always be healthy. And he foresees that he will one day be old and unfit to work. So that's old age and retirement. And he falls into poverty, and if he falls into poverty, even if only through prolonged illness, he is then completely helpless, left to his own devices. And society does not currently recognize any real obligation towards him beyond the usual help for the poor, even if he has been working all the time, ever so faithfully and diligently. The usual help for the poor, however, leaves a lot to be desired, especially in large cities where it is very much worse than in the country. Now, clearly, this is an expression of worry about the state of human well-being for the individual human beings themselves, for their dignity, but more importantly, also for people's ability to participate in the changing societies by way of industrialization effectively and productively. And the natural response, and I think this needs to be understood against certain ideological debates in Germany at the time too. There was concern by some politicians and scholars that if the Marxists, succeed in taking power, they probably will move the country completely to a socialist state. And so some argue that this chancellor introduced the kind of policies he had introduced based on this expression as a way of taking the wind out of the sails of the socialists so as to maintain a certain social status quo or to maintain the prevailing social status quo of the time. And so following that observation, a number of legislations were introduced in the German governance system. They included the Health Insurance Bill of 1883, the Accident Insurance Bill, and here more relating to accidents at an old age and disability bill, then Workers' Protection Bill, and then of course the Children's Act. All these legislations, when you look at them in their various forms, in their original various forms and details, were designed and targeted at giving individuals protection, not only for them to be productive players in the labor market, but also for enhancing the dignity of themselves as individual human beings. Now, beyond that, we also know about the British experience as well, which came much, much later in the period after the Second World War. There is a large volume or body of literature on both cases, but particularly on the British case, going way back to the very, very early years relating to the poor laws and so on and so forth, where also relating to the era when the provision of social policies were really done by, were done on the basis of charity by various voluntary organizations. But it was not until the 40s after the war, when after a study was conducted, a report was produced, and in that in that report, the clearest indication was that the challenges that were facing the British society at the time were the very challenges that undermine human dignity and also undermine the ability of individuals to be productive and be what is desired, like desired of persons within the society. And that report basically suggested that social policy in Britain must wage a war on 5 main giants, which, I mean, clearly were also seen as leading to crisis in the society. And that those have to do with, one, that's the need for adequate income. And here, so therefore, it relates to questions of employment, income protection, and then, of course, also diseases, the need for access to healthcare, and then ignorance, the need for equal opportunity and access to education, squalor, the need for housing, making sure that everybody have a place of abode, then idleness, need for gainful employment, or to be able to earn income and decide on what one is able to do. Following that report, a number of legislations were also passed, which found expression in what we normally refer to as the British welfare state or the welfare state in Britain. And that has to do with Family Allowances Act, National Insurance Act, and of course the National Insurance Act that relates to injuries, then the Health Insurance Act, Town and Country Planning Act, the New Towns Act, and so on and so forth. All of them directing some redistribution or state from the national resources to segments of the population that appeared to be on the receiving end of the fast changes that were occurring in society and some of the ramifications or the effects of the war. I mean, the US, for instance, is considered to be very minimal when it comes to welfare, but clearly a large number of the provisions that have come to foreground the welfare or the social programs or social policy in the US also relates to the Great Depression, when things were very tough for the US as a country. That was when policymakers took some decisive measures to first and foremost protect their most important and valuable resource, which is their citizens, the human beings. And this is actually the case in almost all the other countries as well. And this relates again also to almost all the countries in the advanced industrialized world as far as their social programs and what came to be known as welfare is concerned. Beyond that, I mean, so those were categories where one could say that social programs were introduced largely to respond to emerging crises or emerging social changes that can be framed or could be framed as crises. In the case of post-colonial Africa, there is some literature that suggests that social programs basically mirrored the legacies of colonial rule, but that is contested because if you look at the fine details of some of what the early nationalists in the early post-colonial era did, it appeared that there was a great amount of policy agency based on the kind of situations that they were confronted with. And so here you have countries winning independence from colonial rule, and they were confronted with a number of challenges. You have diverse societies countries that are diverse in terms of ethnicity, religion, and all kinds of things at the time. They are now independent, and independent meant different into different people. But that was not all. There was mass poverty, high levels of ignorance, diseases were commonplace, and there was also lack of basic necessities. Yet the population, having supported their leaders into independence, were highly expectant and were of the belief that independence also meant access to healthcare, water, housing, and so on and so forth. And so most post-colonial African governments decided to actually use social programs to actively address the problem or to deal with the problem. And so there was deliberate and proactive use of social policy to promote, industrialization, modernization, and nation building. And if you look carefully at the framing and the delivery of those policies. It wasn't because the countries were rich and could afford, but clearly it was because of the value found in social policies as the instruments that would at least enhance the productive capability, help unite the people, and perhaps decline a little bit of the ethnocentric feeling and help direct a certain loyalty to the new states. So education was, for instance, provided on the basis of, citizenship. Everybody was allowed to go to school free in many countries. Nigeria had a program like that. Ghana had it, quite a number of other African countries in the early years, largely because the very idea of pursuing modernization and industrialization required a well-informed citizenry. Those who would also not be just literate, but also be scientifically sophisticated to provide the necessary insight and creativity to move the countries to along the path of industrialization as perceived in the vision of the early nationalists. Healthcare was also very important because of the idea that you need a healthy population in order to have a very healthy society. So a large number of these countries at the time embarked on building health institutions and training a large number of young people in the profession so as to be able to attend to the populations that were. Housing program, on the other hand, took a different turn. Housing was provided in a very incremental, and it's normally public housing, in a very incremental, on the incremental basis, and also in tandem with the processes of modernization. So that housing virtually went to people who were working in the public service. I mean, and some scholars have argued that public housing programs were urban bias. People who were working in the public service for the most part were provided with housing. And for a number of reasons, because some individuals will have to move from their original places of abode to new locations. We are all aware, particularly in the Ghanaian case, of how a trained teacher could be transferred or posted from, let's say, the northern part of Ghana or to the south, or somebody from the south to the north. So housing was provided as a way of making sure that protection is provided for people who are being uprooted from their traditional places of abode due to their participation in the processes of modernization. And one of the very creative and innovative things that was done by the early post-colonial leaders in using social policy to proactively deal with or proactively advance the course of development was the establishment of the social security programs in the early post-colonial years. Now, what was unique about this was that the population was young, so really at the time, pension programs shouldn't really have been something of great concern. And of course, beyond the population being young, traditional forms of protection or caring for the elderly were also very strong. But what they did across particularly almost all English-speaking African countries, Ghana, Tanzania, Zambia, Kenya, and so on and so forth, was to establish what was called the Provident Funds. And the Provident Funds were actually retirement savings accounts, to put it, in the simple terms. But the logic behind it was because the population was young, it was foreseen that these savings accounts were going to last for long. So for policymakers, they had intended to use the resources from these provident funds to finance other aspects of development, like construction of roads, dams, the housing projects, building of new townships, and so on and so forth. Of course, all this came to, all this was affected later on by the crisis of the late 70s into the 80s as well. And so in the case of Africa, and in contrast to what we witnessed in Europe and North America, where it was the process of industrialization that was responded to in the manner in which social policy was introduced. In the case of Sub-Saharan Africa countries, you see social policy actually driving the process of modernization. Clearly, social policy learning from the crisis of others and taking the front row so as to prepare people effectively and efficiently to live a good life, but also to be able to be productive agents in participating in making the societies a better one. Then, in all these cases, what we observe is the centrality of crisis. In the German social insurance model, it was a response to crisis. In the British case, it was a response to crises that were looming after the Second World War. Of course, the American Social Security Act also responded to the crisis of Great Depression. And then we also noticed that the ambitious social policy programs in the early post-colonial era in Africa were also designed to tackle what were considered to be crises of nation building, development, poverty, ignorance, diseases, and so on and so forth. The concern for them in all this is poverty, unemployment, the need to enhance the productive capacity or capability of persons, diseases and pandemics, effects of disasters, post-war relief, ignorance and destitution, in whatever form, whether it was being used as a response to crisis or it was being used to proactively anticipate and deal with crisis. There was always a concern about the things or the contingencies that have the potential to adversely or negatively affect human beings, which presupposes that for social policy, the most important ingredient is actually the well-being of human beings and the larger society. In more recent times, there are issues about environment and others that have also been incorporated into the social policy discussions as well. Then the third element has to do with the situation that started in the late 70s into the 80s. New challenges in the advanced industrialized world as far as the economies were concerned. There were new challenges. Population was aging, and there were projections that suggested that the number of elderly people over time were increasing. And because of the nature of the design of some of their social programs, it meant that lots of people were going to be retiring at, let's say, 60 or 65 and spend quite a number of years, perhaps an extra 20 years or more, living because of improvements in medical conditions. And all these individuals, as per the design of the existing social programs, were basically going to be living without working. What it meant was that they were going to be living on the taxes of those who are now actively participating in the labor market. But the crisis was even more reinforced by the projection that suggests that those who will be available to work will continue to shrink because of declining birth rates and high, the longevity of those who were already in the system. The design of some of their social programs, for instance, like the pay-as-you-go pension systems, in particular the English-speaking part of the advanced industrialized world, were also seen as problematic because they had great issues of intergenerational equity. How can we be sure that as we work to pay for the retirement of those who are old now, we will be guaranteed an equal number or approximately equal number of people available working to pay for our retirement as well? These issues came to a head. And then, of course, there were budgetary constraints. I mean, the economies began to face serious challenges. The natural response, and this also coincided with a certain change in the global policy paradigm. I mean, the shift away from what was based on the principles on which the social programs were based to a new policy paradigm based on neoliberal thinking that frowned on states' provision of social services and frowned on in fact, social policy in general, and gave priority to private sector solutions. So we saw in the advanced industrialized world, in what was considered to be the crisis of the welfare state, reforms that were cutting back on benefits. It used to be the case where part of the welfare programs were such that people were given, transfer or money for not being able to work. New policies were introduced that will require you to show evidence that you have looked for work in the last several months or weeks and you haven't found it before you could even get any benefit. Because of course, there is a sense in which some of those welfare programs have also created certain social problems. People were free riding and were basically living large on some of these programs without necessarily without having any incentive to actually engage in active participation in the labor market. And then there was also redesign of social policy rules and commodification of social programs. Education, healthcare, housing were all being commodified in terms of now people have to pay in order to be able to have education. I mean, you have to pay something, you have to be able to pay to have access to healthcare in one form or the other. I mean, it is not uniform in all cases, but you could see the different ways in which policymakers were making efforts to tweak and redesign social programs in response to the crisis that they were facing at the time. It wasn't different in our case, in the case of Africa too. By the late 70s into the 80s, social programs were portrayed as a problem for Africa's quest for socio-economic development. And this is very interesting because just a few years earlier, social programs were highly prioritized by the early nationalists and were seen as, I mean, one of the main instruments through which they could drive the processes of industrialization. But perceiving social programs as the problem led to reforms that cut back on the role of the state. I mean, the role of the state in the provision of social services. And once they were cut back, policymakers actively were encouraged and actively introduced some private sector solutions in what is often referred to as commodification in social programs. You will recall in Ghana, for instance, it was around that time that healthcare became a cash and carry issue, and we all know the ramifications of cash and carry in Ghana. But it was not a uniquely African problem. There was a global shift in policy paradigm towards market solutions, and the feeling that the states, the expanded nature of the states does not create or did not create incentive for individual initiative, entrepreneurship, and so on and so forth. And so the state needed to roll back so as to allow space for individuals to actively participate in the labor market. People should be rewarded for what they are able to give rather than becoming recipients of welfare. Now, so if we come back to COVID, there are a number of things that we can say. Crisis can be used as an occasion to improve and strengthen social programs in a manner that both mitigates the worst effects of crisis, but also creates better social programs and improve long-term crisis preparedness. So for instance, if we decide that given what we know now in terms of our healthcare system and the crisis that we are confronted with COVID, we will invest more in training more nurses and doctors and paramedics and all kinds of health-related stuff. We will be in a better position in the future, not only to take care of our people, but also to be able to deal with any crisis that emerges. You can't go wrong by investing in social programs. And I think the idea that investing in social programs is consumptive is based on a certain weak understanding of the positive backward linkage of investment in social programs to socioeconomic development. There is no way socioeconomic development can happen without investment in social programs. And investments in social programs ultimately tend to yield very positive results in terms of socioeconomic growth. COVID-19 also presents an opportunity for us in Africa to introduce creative and innovative policies and expand on our capacity for information gathering and program evaluation, so that we are able to be in a position where we can build new institutional levers that provides us with an opportunity to anticipate what is to come, but more importantly, be able to also determine what worked well and what didn't work well and how best we could improve on that which we have. We also have an opportunity through this crisis to reduce or eliminate ineffective policies in favor of equitable ones, and also to promote long-term human well-being that supports sustainable growth and good human living. And this is so because in the past, many countries have capitalized on crisis and successfully promoted long-term growth by leveraging on the transformative capabilities of social policies. What is required of us to actually have the necessary forums that allows for the conversations that will lead to creative ideas and that will bring about a kind of transformation that we are looking for. So my final slide, I'm asking, do we need more social investments? Perhaps yes. I mean, COVID-19 and the manner in which it presents itself presents a lot of challenges. For education, we have been on lockdown for quite a long time in many countries. It was not until recently that we are allowed to go back to school, especially for the basic schools. And almost every parent is on the edge, waiting and watching and praying every time the kids go to school. But we can't live like this for forever. And there isn't any promise in the horizon right now that we can return to the era before COVID-19. So we need to start thinking more in terms of post-COVID-19. And post-COVID-19 simply also means that it may just live longer with us. So is this the time to start thinking of education in a different way? And I think some educational institutions have already taken the lead. In all fairness, some of these things have started before COVID, but perhaps COVID makes it even more important now for us to start thinking about thinking out of the box, or using out of the box ways to see how best we can continue to make social programs a priority for and building our society. So could we be seeing a situation where we will invest in homeschooling and e-learning platforms, for instance, as kids remain at home or wherever they are? The idea is not to collapse, organized learning in educational structures as we know them, but new realities and new normal presents also new opportunities. And if we do that, we may also realize that the ever increasing population and the ever increasing need to build new schools in terms of structures may probably not be the case anymore, especially if homeschooling and e-learning becomes part of our educational system. Parents will have the option then to decide whether to keep their kids at home and follow a particular curriculum based on whatever medium they choose. And so that's probably something that, could be thought of. The same could happen to healthcare as well. How do we leverage on technology to make healthcare more accessible? We have shortage of doctors and nurses and other personnel across many parts of our countries on the continent. Is it possible that, given what we are learning from this experience and given the very nature of this particular pandemic, where some people are encouraged to go into isolation in their homes and quarantines in their homes and other places, could we be seeing an opportunity to invest more in telemedicine or training more health personnel who could directly visit people and provide the necessary professional care, as opposed to people walking into facilities when they may not necessarily have to, when probably they don't really need to go into those facilities. In some countries, health personnel visits people at home, depending on your condition. For instance, new mothers, of course, new motherhood is not illness, but the challenges that come with being a fresh mother. New mothers have nurses visiting them at home to support them or keep them company or provide an extra helping hand, and so on and so forth. The same can be said for issues of the labor market, particularly employment. We have seen people working from home, running shifts, and so on and so forth. Is there a way we can turn a crisis also into a situation that brings some flexibility into the way we work? Because there is so much stress in some of the work people do. Is it possible that we can have flexibility and also expect the kinds of output we expect from people? I think it is possible if we set our KPIs right, the key performance indicators right. Then it shouldn't matter at all whether people are working from the beach, or they are working from their homes, or they are working from somewhere else. Housing is very important, and one of the reasons why a lot of African countries have been very unsuccessful in implementing the lockdowns is because people don't have a place to lock themselves down. I recall during the lockdown, I was driving once in town and I asked a young man on the street, why are you here? And he said, well, I am in lockdown. I'm permanently here. I'm in lockdown, so there is nowhere to go. Clearly, we need to think of housing a lot more, because the importance of housing to the human dignity and also to the well-being of the person is key, because if people don't have good housing, the possibility that they may have other serious problems relating to health is also key. And so where you have a segment of the population really not being adequately taken care of in terms of housing, you are likely to pay for it in terms of healthcare or your healthcare bill, particularly if it's publicly funded. And so that is also something that needs to be talked about. Then, of course, I mean, social security schemes as we know them need to be thought through more carefully. There were debates, particularly here in Ghana, during the lockdown, when some private sector companies basically let go of their workers, or the workers really had no sense of what was to happen after the lockdown. There were concerns about where they were going to get, people were going to get income from to live a meaningful, or to have a meaningful life. And in the context of that, there were debates about why should we be saving money towards our retirement when we face crisis now that we need money. It again presents an opportunity for us to think through some elements of the design of our social security programs. Let me end by saying that in all this, I mean, one of the things social policy does is that it presents itself as a very flexible policy, or what do you call it, field, that allows for us to be able to deploy specific tools and instruments, or a combination of some, in dealing with crises that appear to affect, or that affects the dignity and the worth of human beings. Let me thank the center again for this opportunity. Thank you.
Thank you so much, Dr. Kpessa-Whyte, for this. I know some people came late, so just to let you know that our discussion today is about social policy and crisis, and Dr. Kpessa-Whyte's presentation has spoken to the centrality of crisis in the ways that we think about and that we do social policy. He talked about how we sometimes think of social policy as a response to crisis. So we use social policy to address crisis. We sometimes sacrifice social policy when we are in crisis. So then social policy becomes a victim of crisis. And then in times we've also used social policy proactively to head off, a crisis. And so this conversation is about how we can learn from both historical and comparative analysis. So over time and across countries, what kind of perspectives can we have? What kind of insights can we gain to help us to think about our current crisis, this COVID crisis, which he pointed out is not just a health crisis, but is also a social policy crisis, because it has implications. It's not just a health crisis, but also a crisis of education, health, housing, and social security. These are just some of the areas that he touched on in his presentation. So that's just a quick synopsis of what he talked about, but obviously there was much more richness in his presentation than that. So at this point, I'd like to open the floor for questions. I see that there is one in the chat, but also, as I said, feel free to raise your hand and ask a question. Dr. Domfe, I'm going to ask you to unmute your mic if you can and ask your question. If you're not able to speak where you are, then perhaps you can expand your question. You said you want to know something about labor market flexibility in post-COVID-19 Africa, but I don't know what is specifically you want to ask about that. So please either type it or raise your hand and unmute your mic and ask it. I do have one hand raised now. So Dr. Usa Mankwa.
Thank you very much for that insightful presentation, Dr. Kpessa-Whyte. As you have expatiated most of the policies of the developed countries came about as a result of crisis. And we have a lot of policies, social policies in place. We have the social protection policy and other social policies. I want to know, in your estimation, what is the main gap that we need to fill in order to propel the social, social, what should I say? How to propel all of us to work in a way that will support the vulnerable and excluded in society. Thank you very much.
Okay, thank you. Thank you. So I think one of the things that we need to keep in mind is that social policy is really not social protection, and that social protection is probably a subset of social policy. Again, social policy goes beyond just the vulnerable. In fact, we are all vulnerable until social policy allows us to be, allows the vulnerabilities to be either minimized or eliminated. So for instance, if you are born and you never step into school, you never go to school, you may never get the opportunity to work. If you don't go to school, your ability to also understand or to appreciate health education or take health education serious is, and therefore we really are all very vulnerable. But what social policy does is that it is positioned in a manner to lift us out of that particular situation and make us better people for better life, but more importantly also for effective participation in activities that constitutes what we consider to be progress in our societies. I think for us in Ghana and a lot of African countries, and that is why this conversation is very, very important, we must not be deceived into thinking that social policy is an enemy to the economy, or social policy is consumptive, or social policy is unproductive. I think that thinking, it's a question of design and delivery of the social programs. Often people will ask, how are you going to finance it? I mean, the question really is, how were the early nationalists financing it? And as I indicated, one of the very simple means by which they did that was to set up the social security schemes, which were themselves social programs, in a manner that at the time they were generating resources to fund other aspects of social development, hoping that by the time the population would grow old and need that money in terms of payments for their retirement, those areas in social programs that the investments had taken place would have also yielded the needed benefits and provided, the resources back into the pool to take it. So here you have a very creative and transformative way of thinking about, development in a manner that advances the cause of economic growth without necessarily undermining, advances the cause of economic growth using the instruments of social policy. And I think that is one of the things that we need to think. If you look across our various ministries and departments in Ghana and a number of African countries, there are various social programs that are scattered across different ministries, agencies, and departments. That may not necessarily be bad. It's okay to have a Ministry of Education, Health, Housing, but to what extent do they actively communicate among themselves and see the interlocking relationship between and among them? How often does housing relate to health? And how often does health relate to education? And how often does education relate to social security, and so on and so forth? So we need to have, a conversation that brings home to not just policymakers, but also every one of us, that there is a prior activity that needs to take place. And that is that we must have a better understanding of social policy. And in so doing, we will then be able to fashion out programs and policies that will allow social policy to aid, our pursuit of economic development also.
Great. So there are some questions in the chat, and actually you can read them along with me since it's sent to everybody. One is, Dr. Donfred, did you want to ask your question? You want to speak it out? So you typed it up rather nicely. You can go ahead.
Okay. Thank you very much, Dr. Kpessa-Whyte, for that insight. I was wondering when you made suggestion for the labor market flexibility that is working from home, looking at our Ghanaian economy in particular, the inflexibility is quite so high that I was wondering whether it's going to work at all for money. If you look at the sectors of the economy, I want to especially look at the agricultural sector that engages at the moment over 40% of the labor force. And thinking that quite a number of these people have to always physically go to the farm, I'm wondering how working from the home is going to work for them. And even if you move to the secondary sector, I'm talking about the industrial sector. If you look at the way our manufacturing subsector is structured and all the other subsectors under the industrial sector, I find it difficult that even if we were to do anything, only few could possibly work from the house. Even services sector, that is so flexible. Trade appears to be the largest when it comes to labor market engagements. Trade is the largest. And the people who are mostly involved in the trade, we know you go to Makola, you go to Kajitia, the people who are mostly involved. I'm wondering how we can get these people to sit back home, render their services, and still, make their income. And so those were my concerns with the kind of labor inflexibility that we have in our, market. I was wondering whether that suggestion would ever work.
Well, no, I think that is a very important question of the. Sorry.
Yes, I wanted to ask if you could also respond to that.
Our situation. Thank you.
I think there was some leftover. Okay, so I wanted to find out if you could ask that in conjunction with a question by Amos, which is about, I think he asked us more narrowly about social security for informal workers, but I think both he and George are concerned about social policies in a context of informality and our inability to really capture the people who need help because we don't have the data or because they fall through the gaps in other ways. So if you could think about those two questions as one and respond to both of them. Thank you.
No, absolutely. I think that Dr. Domfe's question is very important. The informal economy in our part of the world is something that we need to think about more carefully and also see how best we could bring them along as far as introducing innovative and creative ideas are concerned. I mean, working from home is just one of, many other options. I'm sure that if we put our minds to study closely the kinds of activities that are involved in some of the sectors that you mentioned, like the mining and agriculture and others, we could possibly come up with strategies that will allow for some flexibility. For instance, I know that some institutions are running shifts. They've reduced the number of people who show up at work and also recalibrate the roles and responsibilities so that those who do not need to be physically present give way to those who have to be physically present at the place. So, I mean, working from home may not necessarily work for all sectors, but are there other options that could work for other sectors? I don't know yet, but I don't think that there aren't. I believe that if we put the issue to a larger conversation, perhaps those who actually work in some of those sectors will come up with some of the most creative and innovative ideas that will help us, cross that particular bridge. Then on the question of social security for the informal sector, I think that this is a very important question too. We currently have in Ghana a 3-tier pension scheme that is intended to provide income replacement in old age for people. Essentially, this is formal sector bias. The 3rd tier is expected to provide some incentives for people in the informal sector to voluntarily take on retirement savings. But you can see from the framing of the policy that it is not grounded in the understanding of the structure of our country. Large number of people in the informal sector hardly make a good living. I mean, they really are living from hand to mouth. And so you design a policy that asks them to take advantage of a tax incentive. You haven't really done anything. And so I think that there is the need for the state to deploy some of its fiscal policies in engaging in redistribution more directly. One of course, some of the people in the informal sector could afford, but there is also the problem of myopia. I mean, I'm working now in the informal sector, I'm making money now. Well, tomorrow I will save for my retirement. Tomorrow I will save for my retirement. Tomorrow I will save for my retirement. And then before you know, the years caught on. And that problem of myopia has been solved for those who work in the formal sector because government made it mandatory for them to contribute. In fact, government withdraws the contribution even before your pay hits your bank account. And so there is an element of inequity there. One way to actually deal with that problem is to tie contribution to attractive incentives. So for instance, I mean, there was a time when Smith was building houses, and I think they ended up renting those houses and in some cases selling those houses. I think that was really not a very creative use of the Social Security Fund. What could have happened actually was to tie ownership of houses to contribution, particularly for informal sector workers. If you are working in the informal sector, some of our mothers in Nabobloshi, Makola and others could afford to actually make monthly payments to the scheme, but they don't have any incentive. But if there is an incentive that a contribution also entitles you to, let's say, housing, or a contribution entitles you to certain funding that goes into your ward's education, I am inclined to think that people will actively participate. And this example actually illustrates the interlocking relationship that I spoke about earlier on about social policy, that you don't think of them in a straight-jacketed manner. You actually have to think of it in terms of how does one relate or complement the other in order to solve an otherwise major problem.
Okay, thank you. I actually made a mistake. It wasn't Amos who asked the question about informal workers. It was actually Samuel Boachin Mafo. However, Amos's question was along the same lines of inclusivity, especially looking at people in rural areas. So I think your responses have covered some of those concerns. There is a question here from Frank, and so I'm going to ask that question because it came quite early on, and then we'll go to Jonathan and Kwejo who have their hands up. So Frank Cabo of NADMO headquarters wants to know, how can we, Ghana, and by extension Africa, think systematically going forward to be able to develop and roll out holistic policies across all sectors of the economy to shore up our already weak economy vis-a-vis the negative impact of COVID-19? That's a big question. Do you feel up to tackling it in the short time you have?
This is more like asking us to develop a national development plan right here before we close. But I think that it's a very useful question, and it begins with these kinds of conversation. And I think that the center has done a great job by bringing social policy to the front of these kinds of discussion. And hopefully it will not end. One way to do this is for a lot more of our students and our researchers to take active interest in social policy. Social policy has been the single factor of social science research in Europe over the last 50 or more years. It has been researched by many social scientists across the different disciplines, coming from different angles. Those who were looking at expenditure patterns, those who were looking at institutional design, those who were looking at demographics, and so on and so forth. And so we really need to appreciate the need to take it a little bit more serious at different levels, and not have the kind of negative connotation that is often associated with social policy, largely based on certain misconceptions about socialism and capitalism debates. Social policy is just about, human well-being, and everybody wants to be well. So if you want to be well, you must be interested in what goes into social policy, and that actually is what it is. So the place to begin that conversation, I see Frank is asking, how can we do? The place is actually to begin a conversation of this nature And with conversation, other things will logically follow, I want to believe.
Well, somebody has an interesting comment where he seems to be saying that we are focusing too much on social policy. So that maybe we'll bring that up later. But for now, let me allow Jonathan Bildo to unmute his mic and ask his question.
All right. Thank you very much, Doc. I just want to pick up on this idea of interlocking relationship and tie that to the idea of home. And to ask that to what extent can home be a subject of concern for government in social policy formulation, precisely when we are talking about homeschooling and e-learning. So it raises questions about what is the educational context of a home for a student, and should that be left alone for parents to design, or for government to be interested in specific elements that should constitute a home or housing for students in terms of homeschooling and so on? Thank you.
That's a fascinating question.
Thank you very much, Jonathan. I think that is very, very important a question. But the question actually borders on details of policy design. It would not be in the interest of any society to say we are doing homeschooling, and so we left it entirely in the hands of parents. I think it is important. Others have done this before. Other countries are doing it. It is important, first of all, to do this as a matter of option. And the option must come with specific, for lack of better word, rules and criteria that qualifies, homes to be given the opportunity to do this. And this is so because, the kids that are to be homeschooled are the kids of their parents, but they are also first and foremost citizens of Ghana, and their well-being as good citizens must be of paramount interest to the state. And so a number of incentives can be deployed to make it attractive to parents who have the capacity and have what it takes to actually engage in homeschooling. And this probably will involve, the Ministry of Education, or GES, actively designing an elaborate system that allows them to be able to visit places, that families that are opting for this, and be sure that they have what it takes to do this. So that is one. And then of course the e-learning too, the kinds of facilities or elements or equipment that you need to be able to undertake it. You need a stable network, you need this, you need that, you need to be able to familiarize with whatever platforms the learning is taking place and all that. So I think that the most important thing as far as this conversation is concerned is to throw out the idea. And if the idea is acceptable or is something that Ghana as a society feels, okay, this can very well complement our educational system, then the issue of design could be deployed to do it the way in which we will have it giving us the best. Curriculum definitely will have to follow whatever curriculum exists in the country for every level of the education. And of course, you can't, let me just say that we can't talk about the details of design here, but what we can talk about is to basically say, this is an idea that we can, and it's in the long term, it could have a positive backward linkage to, capital expenditure in education, because our population is growing. We have just started implementing free SHS, and immediately we're realizing that the space to accommodate many of these young people going into free SHS is unavailable. So fundamentally, it raises a question of, are there families that could have afforded to have their kids schooled at home? And what kinds of incentives could have been provided for those families so that we will decongest the schools? And as I have indicated, there have been, this practice have been in operation in some other countries for a very long period of time. It is fair to say though that when we say homeschooling, it does not necessarily then mean that you leave it entirely to the parents on their own to do. It is also fair to say that the educational system as we have it now, where kids go to school together, has a certain social bonding element to it that is very important for peaceful coexistence, for all the things that we cannot quantify, but they are very important for our growth in society. And so when kids are schooled at home, some of those things are taken out, and that the kind of exposure that they would have otherwise had may be taken out. So it's something that opens itself up for a larger conversation.
Yes, and thank you for ending that on the word conversation, because I did want to point out that this is not a Q&A session. We were serious when we said we wanted to have a discussion, a conversation. So you don't have to just ask questions. You can make an intervention. You can make a comment. I know that there are people here who spend a lot of time thinking about social policy and doing social policy, and we all want to benefit. And interestingly, Professor Adeshina has made an intervention in this conversation about homeschooling and sort of where's the purview of national, the government in doing social policy, and how far into the home does it go. And he's pointing out that we have to be mindful of the gendered consequences of homeschooling and the kinds of solutions that we are coming up with, because the burden will fall excessively on women and will then undermine the social policy concern of reconciling social reproduction with other social roles, including in the labor market. So this is, yes, this obviously complicates the way that we have to think about and come up with solutions so that people are not inordinately burdened. And this also brings up a question that, Professor Dakwa is also saying, might I also add that girls who are homeschooled may also not get out, that's really true, may also not get as much out of homeschooling as would like, because daughters will be burdened along with their mothers in care responsibilities. So there will be gender inequalities, not only for parents between, mothers and fathers and other adult caregivers, but the children themselves may have unequal outcomes.
No, I think these are very, very great, observations. And the fact that, we could even think about them now, the fact that we know from, our past or our history that there have been things that have been done gender-wise that were not very beneficial to society is enough an opportunity for us to, if we decide to go this road, to start thinking through how we can ensure that the burden of homeschooling does not become one that basically makes it, the woman's role at home or the little girl's role at home or whatever the case may be. But you are right. Our very conception of home itself has the potential to make the burden fall on women. And I think that definitely it can be dealt with.
Which just again goes to show that we really do need to put a lot of thought into designing social policy. That is not simply, giving money to people or saying we are helping one segment of people. There are always ripple effects, and we need to realize that this is all very complicated. And as you said, spend much more time thinking about this and designing things properly. This would have been a good time for Jifa Toveke. Dr. Toveke, you had a question about how can we do, let me see if I can find it. How can we fashion our collective care as a social policy option? And I wanted to know whether you wanted to elaborate a bit on that, because I think this is a very relevant part of the conversation for this question. Or is she not there? Okay, maybe we'll have her come in at some point. So collective care as a social policy option, I am not, do you have a sense of what she might mean, Dr. Kpessa-Whyte, or should we wait until she can?
No, I believe she may have to clarify a bit more.
Okay. Okay, so there was also a question about the fact that our healthcare sector is already sort of constrained by the brain drain, our involuntary exports of our healthcare personnel to other countries. And somebody, Cletus Buya is wondering what the COVID pandemic will mean for that already dire situation when poor countries not only have a brain drain in terms of healthcare professionals, but that healthcare professionals are also now at risk with the COVID pandemic. He says, do you consider that an imminent problem of social policy importance? And what kind of responses should developing countries like Ghana envisage to mitigate these effects?
Well, I mean, I think that the COVID situation has implications for healthcare, and we all know what the implications are. And we also know that the frontline actors in terms of health service providers are probably even much more. But it is also fair to say that by the very nature of their training, a lot of them are also able to navigate the challenges. There are occupational norms that they have already internalized that only need to be persistently, they need to persistently follow those particular principles to be able to navigate some of the challenges. It doesn't mean that it eliminates the threats that they are faced on a regular basis, in my view. But I think the question of, healthcare professionals moving away or the health sector facing the brain drain is one that can also be addressed by basically thinking through the factors that make it easier or that incentivize people to decide to leave their countries of abode and go and ply their trade somewhere else. And there is a lot of literature on this, professional brain drain thing that we can look at and as a society decide what we want to do in solving that problem. The thing is, we don't at the moment have adequate doctors, nurses, and other health professionals. And we also have a very poor distribution of the few that we have. I'm told that we have more medical doctors in perhaps Ridge or Kolebu alone than we have in Upper East or Upper West alone or combined. I mean, there may be reasons for why this is so, but I think that we need to look into the distribution more carefully and also train a lot more, because if we consider the fact that the most important ingredient or the most important factor for any society is its human resource, then we must put a lot more effort into what it takes to empower, encourage, and protect people as far as their professions are concerned. And this goes not only to nurses and doctors, but I think that in other professions like teachers and others also deserve some of this attention as well.
Okay, we have a little bit more time, so I'm just going to point out that there is a conversation, and because I happen to know the people making their comments, I know that this might be one of those researcher practitioner kind of divides, right? Where we tend to talk about what might be ideal, what is normative, and then practitioners want us to also consider questions about capacity, about resources. Actually, this resource question has come up today, and it also came up during Professor Adesina's presentation. So Ebenezer Ajete Sorsey wants us to think, he says we seem to be thinking more about the policies, right, and talking about policies that are needed, than thinking about the capacity required. So I suppose that would be both financial and human resources, and whether we can actually implement them properly. And Ibrahim Tanko Amidu also seems to have a similar kind of concern, saying that Ghana is good at developing policies, but extremely poor in implementing them, primarily because of how and who decides how resources should be allocated. So how do we factor in, his question is, how do we factor in the fact of our resource constraints and also just the, I guess, political context in which these policies have to be done, and then also the human capacity to actually implement them? Are these, I guess, realistic what we are saying? Do we really need more or better policies, or do we just need to figure out a way to do them better?
I think we need a combination of all, if you ask me. We need a combination of all. We don't, obviously do need better policies, but is it Tanko or somebody? I think is right. We are very good at fashioning up policies, but implementation is and enforcement is actually a problem. And so we need to commit a lot more energy to how best our policies can be implemented and enforced, especially those that relates to human behavior, direct human behavior, either in a professional line or in an institutional practice. And that can go a very long way. I mean, there seems to be no punitive measure for people who flout the rules, even openly, whilst we all watch. And I think that observation is actually apt. That's for the issue of finance. It's always the thing that is used to, what do you call it, for lack of better words, scare good ideas from finding their way into policy or into becoming a policy and then finding life in programs and then impacting society positively. I think that there are always creative ways. And as I kept coming back to the early post-colonial era, if you look even today at our 3-tier pension scheme and the amount of monies that have already been generated to private sector actors who are participating in the 2nd tier of the pension scheme, within a decade, they have been able to overtake the amount of money assets that is available to SMEs. Yet they also have a relatively small number of people participating on their side. That clearly tells you that if we put our mind to it, we could be able to internally generate a lot of these resources and turn them around to finance some of the very sound and good policies that have the capacity to, I mean, open up an opportunity for other means of generating revenue and also improving the larger society as well.
Okay. I think that's about it. There are also some comments that I'm sure people are reading and absorbing. I don't see any further hands up. I'm sure we'll continue to come back to this question of financing because it does seem to be a one of concern. But as both you and Professor Additional last week pointed out, it might be more of a problem with our perceptions than of reality. But I'm sure it's something that we'll continue to discuss. I'm going to come back to you, Dr. Kpessa-Whyte, for your last final take-home message, right? If people came late or they forget everything, what is the one thing from your topic of social policy in times of crisis that you'd want us to take away from this presentation? But let me just, first of all, give some credit to the Ghana Employment and Social Protection Program, who funded this webinar series. We are very grateful for the opportunity to have some funding so we can have these kinds of conversations. We are going to use the funding to develop, I'm not sure we want to call them policy briefs. Let's just say briefs. Some write-ups that we can circulate and also put online for those of you who may have missed some parts of the series or just want to have something written to refer to once in a while. We've got the first one ready. We want to package it very nicely and send it out. So that's part of what we are using the funding for. I also want to say thank you to the Gender Equitable and Transformative Social Policy in Africa project, the GETSPA project, of which Michael Kpessa-Whyte is a co-principal investigator. The project really is trying to move this conversation forward about what kind of social policies we've seen and what kind of social policies we need in Africa, and not just as an intellectual exercise, but also trying to really involve partnerships, including with policymakers and practitioners to try to develop transformative social policy. So that will actually be the topic of our third and final webinar next Thursday. that will be delivered by Professor Georgie Chikata, who's the lead for the GETSPA project. And so she will be talking historically, but more prospectively, about gender equitable and transformative social policy in a post-COVID Africa. So I hope that you will come for that. And I want to thank you for coming today, and especially those of you who are two-time attendees from last week and today, I want to thank you too. And so now back to our presenter, Dr. Kpessa-Whyte. What's your final word for us on this topic?
Well, thank you very much, and thank you to all the individuals who have made it a point to attend. Your time is very well appreciated, and thanks to the center too. But let me say that, I mean, this is an ongoing conversation. What we should take home is that crises always offer opportunities, especially when you think about social policy, and that much as we are thinking about disruptions in our normal ways of life, we need to think also about what kinds of creativity or innovative solutions are available within the larger repertoire of social policy tools, either individually or a combination of some, to resolve some or all the crises that we are confronted with now. Many people see the pandemic as a health crisis, but as we have alluded earlier on, it is one that is affecting almost every facet of our lives as well. Finally, I should say that we must look at this crisis not as one that can be resolved through social protection. I mean, I think social protection is a narrower way of trying to approach this problem. Social protection is beyond social. I mean, social policy is beyond social protection, and as much as social protection is good and is a platform that provides relief and everything, we must think of social policy more broadly. And it is in so doing that we'll realize that the very elements of poverty and neglect and destitution that we want to use social protection to solve, a very creative design of social policy would have even made sure that those issues would not arise in the first place.
Thank you. Thank you so very much, Dr. Kpessa-Whyte, and thank you again to everybody who attended. I know there were still some questions. Evans had a really interesting question, and I really hope that you will come back next week and ask. Dr. Kpessa-Whyte won't be here, but it's a relevant question for the entire series. And I'm sure Dr. Chikata or other people in the audience will take a crack at responding to it. So thanks to everybody once again, and we hope we'll see you next week. Have a good rest of the week. Goodbye.